Today we will discuss about anemias. So what is anemia? It is a condition that can occur because of reduction in the oxygen carrying capacity of blood, which can occur either because of decrease in the RBC count or because of reduction in the hemoglobin concentration. You can see the values here. Coming to the classification of anemia, first is by the Whitbread's classification, deficiency type of anemia. That can occur because of deficiency of certain factor, for example, deficiency of iron, vitamin B12, folic acid, proteins, vitamin C. Blood loss type of anemia. Haemolytic anemia, it can occur because of intracorpuscular defect. Intra means inside corpuscular cell. Okay. Examples are hereditary spherocytosis, sickle cell anemia, thalassemia, hemolytic disease of newborn, and any condition that is outside the cell by extracorpuscular defect, seen in case of antigen antibody reactions, malaria, hypersplenism. Next is aplastic type of anemia. It occurs when there is excessive exposure to X-rays, gamma rays, sulfur drugs, or in case of malignancy. These conditions, they cause suppression of bone marrow. About the Winthrop's classification, you can see certain terms here: normochromic, hypochromic, normocytic, microcytic, macrocytic. We had talked about these terms in the previous presentation. Normochromic, normocytic type of anemia, it can occur in case of acute hemorrhage, all types of hemolytic anemias, but not in case of thalassemia. Seen in case of aplastic anemia. In case of thalassemia, you can see from this slide, there is presence of hypochromic microcytic type of anemia, which is also seen in case of iron deficiency anemia. Normochromic macrocytic anemia, it occurs in case of megaloblastic anemia. Now we will concentrate over iron deficiency anemia. So iron deficiency anemia, it is the most common type of anemia which is seen in our country, in India. It can occur because of certain factors. First of all, we'll discuss physiological reasons. After that, we'll jump to the pathological causes. Among the physiological causes, first is increased demand. Now this increased demand, it can be seen in case of adolescent girls, during menstruation, in case of pregnant females or lactating females. Secondly, when the absorption is reduced, if the person is consuming more oxalates in the diet, iron absorption will be decreased. In case of teenage pregnancy, repeated pregnancies, repeated abortions, iron deficiency anemia can occur. And if there is reduced iron intake, poor people, they consume lesser amount of iron. Exclusively milk-fed infants, they can also suffer from iron deficiency anemia. If we see the pathological causes, excessive loss of blood during menstruation, piles, hookworm infestation, malabsorption, gastrectomy, hypochlorhydria, achlorhydria, hemoglobinopathies, all these factors can result into iron deficiency anemia. Now about the presentation. There can be occurrence of pallor. This is the sign of iron deficiency anemia. Pallor over the conjunctiva, skin, and the nail bed. Nails, they seem to be very dry, brittle, and spoon-shaped. You can see here. Tongue, it appears to be angry red type. Person can be seen suffering from atrophic glossitis. Lips can be dry, crack type, dysphagia. Among the symptoms, there can be presence of generalized weakness, headache, lethargy, dyspnea, breathlessness, tachycardia, palpitation, nausea. Now, how can we diagnose that the person is suffering from the deficiency of iron, not from the deficiency of any other factor? First investigation we always prefer is peripheral blood smear. As previously discussed, there is presence of microcytic hypochromic anemia. Hemoglobin concentration will be lesser, RBC count will be decreased. If we will focus on the serum ferritin and serum iron, both these will be decreased. So by all these parameters, we can say that the person is suffering from iron deficiency anemia. Now, how can this condition be treated? First of all, by supplementing diet with iron. If we try to cook our food in the iron utensils, taking oral or the parenteral form of iron, orally we can take ferrous sulfate with elemental iron, parenteral iron like iron dextran, iron sorbitol, iron sucrose. If there is presence of any underlying infection, that can be treated. And lastly, in case of severe anemia, we can go for blood transfusion. Also, preferably there is transfusion of fresh blood. Okay, because around 80% of the red blood cells, they survive after 24 hours of collection of blood, and 1 unit of blood, it increases hemoglobin by around 1 gram percentage. Okay, now we'll talk about megaloblastic anemia. Megalo means large, so there is presence of abnormally large cells of erythrocyte series, and there is defective DNA synthesis, because this type of anemia occurs because of deficiency of vitamin B12, folic acid, and these are required for the DNA synthesis. Now, this type of anemia, it can be seen in strict vegetarians. Okay, because mostly the source of vitamin B12, they are meat, poultry, eggs, dairy products. Okay, if there is deficient absorption, like in case of pernicious anemia, we'll talk about this, in which there is deficiency of intrinsic factor. Okay, in case of folate deficiency, now folate deficiency, it can occur because of more demand, like in case of pregnancy, lactation, malabsorption, or drug induced. For example, if the person is taking methotrexate, it can sometimes result in deficiency of folate, ultimately resulting in megaloblastic anemia. Now, about the clinical manifestations of the condition. There will be anorexia, generalized weakness, pallor of skin, mucous membrane, dysphagia. If we'll talk about the cardiovascular manifestations, there can be presence of tachycardia, palpitation. Okay. After that, some gastrointestinal manifestations like atrophic glossitis, angular stomatitis. After that, the neural manifestations, headache, lethargy, peripheral neuropathy. Sometimes can be dementia, loss of position, vibration sense. But in advanced cases, there can be presence of subacute combined degeneration of spinal cord, in which there is demyelination of white fibers of spinal cord. Okay, initially it affects the dorsal column, and later on lateral column is also affected, and that can result in tingling sensation and numbness over hands, feet, along with some psychological manifestations. Now, about the diagnosis, we had seen in the previous slide, anemia is of macrocytic, normochromic, and there is presence of oval macrocytes, abnormally large type of cells, and neutrophils are hypersegmented. Okay, you can see here in the figure, there is presence of hypersegmented neutrophils and abnormally large blood cells, oval macrocytes. Now, how can we treat the condition? Underlying cause, if there is any deficiency, that has to be rectified. After that, there can be replacement therapy. Vitamin B12 can be given to the patient. Now, a word about Addisonian pernicious anemia. Okay, so this is a type of megaloblastic anemia which occurs because of deficiency of vitamin B12. Okay. Now, about intrinsic factor. This factor, it is required for the absorption of vitamin B12. Therefore, in case of pernicious anemia, there is deficiency of intrinsic factor. It fails to get secreted because of autoimmune atrophy of gastric mucosa, and there is presence of antibodies against intrinsic factor. So the immune system of the body, it attacks and destroys the cells that produce intrinsic factor from the stomach. So the body is unable to produce the intrinsic factor, and hereby vitamin B12 cannot be absorbed. Okay. This is Addisonian pernicious anemia. Next type of anemia is folic acid deficiency anemia. In this type, anemia is a late finding. There is presence of megaloblasts, large sized RBCs, and the person can present with loss of weight, loss of appetite, weakness, palpitation, headache, irritability, risk of low birth weight babies, and neural tube defects. Can be treated by dietary supplementation. Orally, folic acid tablets can be given to the patients. Okay. There is one reasoning based question that can be asked. Why use of folic acid? It is contraindicated in undiagnosed anemia patients. We will discuss, I had already told in the previous presentations also, all the reasoning based questions of hematology. They can be covered under one presentation. I'll discuss all the reasoning based question. Okay. Next type of anemia is haemolytic anemia. First example is hereditary spherocytosis. Hereditary, it is a congenital condition. Spherocytosis, there is loss of biconcave shape of RBCs and they will be now spherical shaped. So they tend to get hemolyzed, broken down very easily. Fragility will be affected in this case. Okay. The condition, it can be treated by dietary supplementation, in severe cases blood transfusion and splenectomy they can be done. Second example of hemolytic anemia is G6PD deficiency anemia. Means glucose 6-phosphate dehydrogenase deficiency anemia. It is an inborn error of metabolism in which there is deficiency of enzyme G6PD. Okay, and this enzyme, it is involved in HMP shunt, your hexose monophosphate shunt. Okay. This enzyme, it is required for the formation of NADPH, which in turn is required for the maintenance of glutathione in the reduced state. When glutathione, it will be in the reduced state, it can be helpful in disposing of the reactive oxygen free radicals. Okay, they can further cause oxidative damage to the cells. So in case of the G6PD type of deficiency type of anemia, there is presence of low level of reduced glutathione secondary to low NADPH, and the person will be exposed to the risk of hemolytic anemia during oxidative stress. So we have to avoid the drugs and foods that can cause hemolysis, and in severe cases we can do blood transfusion. Now we had seen two words here, hinge bodies and bite cells. These are seen in case of G6PD deficiency anemia in case of peripheral blood smear. What are hinge bodies? Red blood cells with the precipitates of denatured globin. These are the hinge bodies and they can be revealed by the supravital staining. Okay, and as the splenic macrophages they pluck out these inclusions, bite cells are formed.